Hello, this is Dr. Reddy from Seven Oaks Pet Hospital, Wesley Chapel, Florida. And thank you all for joining the call today. It's Thursday, the March 4th. It's around noon. Today we are going to talk about snake bite cases in dogs and using anti-venom, and also the clinical signs, what we can see when dogs are bitten by snakes. That happens, believe it or not, very commonly in Florida. And Florida has, in general, not many poisonous snakes. There are 5 to 6 different varieties of poisonous snakes in Florida. There are some more common in southern Florida and some common in Tampa area. And I'm going to talk about some of the common snake bite cases we see here in Tampa, in Wesley Chapel, around this area. There are pygmy rattlesnakes we see. There's a water moccasin snake bites we see. Those are poisonous I'm talking about. Non-poisonous, there are a lot of snakes. I'm not going to talk a whole lot about them because they're non-poisonous. They don't cause much problems to dogs or cats. But poisonous snakes, like I said, pygmies, cottonmouth, rattlesnakes, and water moccasins, copperhead and diamond head are the other ones, but I don't see that often here. So these are very poisonous snakes. And then the poisonous snakes, they do, when they bite a dog or a cat, most of the time they bite the extremities, the face. Thank you, Sandhya, for joining, and Miss Clark, thank you for joining. Yes, coral snakes, yes, she reminded that. Thank you, Miss Clark, for reminding me that too. Coral snakes are common too. So going back on the snake bites, they're mostly on the extremities, the front legs and the face, or the head I call, or the chest. And the closer the bite to the chest or the heart is more dangerous to the dog or a cat. And yeah, chest, if a snake bites the chest, I think that would be the worst case of poisonous snake bite, I would say. It would be a little bit, you got to rush to the veterinarian's office as quickly as possible, because that would be the worst one. And a lot of times we think, or the clients think, that if there's a snake bite happened, you can basically suck that venom out of the dog with your mouth or something. I generally don't recommend. Those are all saved for films. I guess we see those in films, but that's not right to do. So don't do all those things. If you suspect a snake bite, the most important thing you have to do is make sure you can get a picture of a snake, what kind of a snake it is, so we can identify the type of a snake and figure out if it's a poisonous or non-poisonous. A lot of times you can actually send pictures to ASPCA or Poison Control of state of Florida too, and they can tell you if that is a poisonous snake or not. And you can always send it to us at Pet Urgent Care or Wesley Chapel, Seven Oaks Pet Hospital, and we can definitely look at the type of a snake and tell you. And as soon as that happens, so you take a picture of the snake, make sure you have that picture, and then check where the bite marks are. And once we know that it is a poisonous snake, you have 4 hours. Within 4 hours, if you could bring the dog to any veterinarian who carries anti-venom, that is the most important thing, because just in case if it happens to be a poisonous snake bite and then you're at veterinarian's office and they don't have an anti-venom, then you're losing that window. And we at Seven Oaks Pet Hospital and Pet Urgent Care, we carry an anti-venom, and I'm going to show you, we have a couple types of anti-venoms, and this is one of the anti-venom we carry. It's pretty expensive while we carry, and we use this as an anti-venom if we know that what type of a snake it is and if it's poisonous or not. And this anti-venom, again, like I said, it's an expensive one, and we carry it. A lot of times we use it, but sometimes it does expire and then we have to trash it. But we carry it, the reason to save at least, we can save one life that is worth it to do that. And we don't charge any extra on top of what we pay for the anti-venom, so we try to do it because they're so expensive for us, so it gets more expensive for the owner, so we try to work it out with cost, plus whatever the treatment would be is what we charge. And sometimes that itself can run into $1,000 or so for anti-venom and injections, fluids, and medications, hospitalization. So we want to minimize the snake bites as much as possible, and there are some or avoid snake bites, and there are some other things you can look at how to avoid the snake bites, especially try not to walk your dogs in the areas where there are a lot of bushes, or make sure they are clean pathways, and try to keep your dog leashed within your 4 to 5 feet of yourself, so if you had to, you can pull the dog away if you suspect there's a snake in there. And also not walking during late at night, because those are the times when snakes likes to venture out. They don't like to venture out during middle of the day or mid-afternoon, so that is another way of avoiding some of the snake bites. And when it happens, always suspect that it is a poisonous snake and try to be proactive. If you don't have a picture or something, at least let's bring it to the veterinary office and then figure it out what needs to be done. We'd rather be safer than sorry. So that is another thing about the snake bites, is if we can see the dog within 4 to 6 hours, we can do an anti-venom, and that can actually save the dog 99% of the time, or 95% of the time we can save the dog if we know, because anti-venoms are if it's circulating in the blood, if venom is circulating in the blood, the anti-venom we give, it would help to neutralize the venom in the blood. Sandy asked, how would a dog react to snake bite if the bite happens without you seeing the snake? If the bite happens, how does the dog would be very painful. I would say they do yelp, they do cry when that happens, and always try to look for any fang marks when the dog is crying, if it's on the legs or on the face. And also sometimes you see severe swelling right away, and that's or bleeding can happen too, so that can be a sign. Emily asked me, if my dog gets bit during a non-poison snake, should I still bring them in? Yes, if it's a non-poisonous snake, you don't have to bring them in right away. But also sometimes you have to remember non-poisonous snakes can cause bleeding, swelling, and painful, because it stings the skin, and it injects some type of a defensive saliva or something that can also cause a little pain. But again, even if you wait a day or two, it's not going to be end of the world. If it gets infected or something, then we can look at it and see what it is. But most of the time, if it's a non-poisonous snake and for sure it is, all I would do is recommend just clean the wound as a regular septic solution, antiseptic solution, and then just do like a first aid. And if you see some swelling it started happening, then you may have to bring it. So that was a good question, Emily. The other thing about snake bites is, I'm not sure if you guys are familiar, we do have or have a vaccine for snake bites, for snake cases, but we don't know 100% the efficacy of that vaccine. That's why we are not offering that vaccine as routinely as we would for other vaccines, other conditions. But there are people who do get vaccines. I would say if you have a hunting dog and you like to take your dog for hunting all the time, and you think that dog would get exposed to those snake bites, then maybe vaccine might help. The vaccine, what it does is it doesn't prevent. Let's say if your dog is vaccinated and he is bitten by a snake, you still have to get an anti-venom still. The vaccine does not protect your dog from snake bite in the event a snake bite happens. So at that point, you still have to bring it to a place where they have an anti-venom and get an anti-venom injection done. The advantage of having a vaccine is probably you'll see less clinical signs or less reactions to the anti-venom, less reactions to the treatment, less intensity of the snake bite condition in a dog. So that might help. But again, we don't recommend um, anti-venom, vaccine for every dog which walks into our door. So there's a reason we would recommend. And Emily asks, does the anti-venom work on cats? Yes, it's the same anti-venom we use for dogs and cats. And believe it or not, cats don't get bitten by snakes that often as dogs get. Cats are pretty smart. I think they know how to maneuver around snakes probably. So it's definitely not many we see. Ms. Clark asked, "Is annual antivenom the same as for humans?" No, it's a different antivenom we use, and the antivenom we have is specifically meant for dogs. Again, this is the vial I have in front of me, and it's a horse serum based antivenom. So that's what it is, and I can't talk, or I don't know 100% how the human antivenoms are made, but this is specifically made for dogs. And maybe I think it is from horse's serum too for the humans too, but this one is specifically labeled for dogs. So that's about the vaccines for snake bites, and that's an antivenom for snake bites. And just talk about in general the treatment for snake bites. Yes, snakebite treatments can be very aggressive and invasive and expensive too, because it does involve fluids, blood work, clotting factor checks, making sure the platelets are okay. And again, whenever a dog comes, I at least try to score it between 0 to 20 and see where the dog is in terms of the snake bite, because again, even if the dog has been bitten by a poisonous snake, there is a data which says 25% of the time the snake might not have injected the venom into the body. So there is a chance, 25% chance, that your dog may be bitten by a poisonous snake but might not have a venom in the system. So that can also happen. So that's why when the dog comes in, we look at all the clinical signs there, and based on those clinical signs, cardiovascular signs, neurological signs, platelets, blood work, PTT, clotting factor check, and then physical examination, swelling. Based on all those, we score between 0 to 20, and if we are getting closer to 16, 15, 14s or so, higher marks, higher scores, then we decide that, okay, you know what, I think it might be worth doing an antivenom treatment for your dog, because looks like he or she got the venom into the system. If it is close to 4 or 5 or something, maybe again, the venom might not have taken the course of effect in the body, so we may be able to treat symptomatically. And non-poisonous snake bites also, a lot of times, we see swelling, we see some type of edema, and dogs are very painful. So we take an approach of just a symptomatic treatment, IV fluids, pain medications, and try to do some type of a laser therapy or so to decrease the swelling of that area. So those are the things we can do to help with snake bite cases. And like I said, I think we are one of the 2 or 3 hospitals in Tampa Bay area who carries antivenom. So we do carry antivenom always in stock. We have 3 or 4 vials, so just in case, if any time we need. And on an average, I would say we see 2 or 3 cases of snake bites at Seven Oaks and Pet Urgent Care between both the hospitals. We do see those things, so it's not uncommon as we think, but at the same time, it's not that common. But we rather not see any snake bites, and there are ways to prevent snake bites cases, or snake bites in dogs especially. So poisonous or non-poisonous snakes, and I think good thing is in Florida we have a lot of non-poisonous snakes than poisonous snakes. There are only a few poisonous snakes closer to the water bodies, I would say, than the non-poisonous snakes. So which is a good news, I think. But at the same time, still try to keep a close eye on your pets from snake bites as much as possible, because that is one of the most painful thing to see. And again, not necessarily every time a snake bites you would see 2 fang marks. I mean, I have seen absolutely no bite marks at all, but it was a snake bite. Based on the blood work and the smears we have done and everything else, we concluded that it was a snake bite, and we treated with antivenom. So like I said, again, Seven Oaks Pet Hospital carries anti-venom, and also Pet Urgent Care carries anti-venom in the Tampa Bay area. So other than, I think there are maybe a couple other hospitals which might be carrying it. So I think that's all I have today for anti-venom and snakes. And we do carry other antidotes for other poisonous conditions, which we will talk about that probably in the next call or so. Um, Again, we wanted to just cover the snake bites and antivenoms today, basically. Uh, Again, I think that's all I have today, and I would like to conclude this. Thank you all for watching the session today with me, and hopefully, we'll not hopefully, but for sure, we will do another one next Thursday at noon around the same time, and we will probably announce the topic in the next day or two. All right, thank you so much, guys, and you all have a great day. Thank you. Bye bye.